Pikeville Medical Center, where together we are focused on growing important service lines such as pediatrics, primary care, cancer care, and the Heart Institute. We are building a regional health network to care for all we serve. Pikeville Medical Center, where today's announcement represents over $50 million in new investments, new jobs, and superior patient care. Where we are growing, recruiting the most talented, experienced physicians and clinical staff to work with the state's best medical technology, offering more than 400 services and the region's only Level 2 trauma center. Pikeville Medical Center, where service means outreach to our communities, as close to 3,000 employees work every day to comfort, to heal, and to serve. Where we are building a network of convenience by reaching throughout and beyond our service area to forge a stronger future for our region. Growth, service, convenience. It's a commitment we've made because at Pikeville Medical Center, together we rise. Together we grow. Together we succeed. Ladies and gentlemen, please welcome Donovan Blackburn.
Well, good morning, everyone, and welcome to today's event. We're extremely excited over several announcements that we'll be making later today. Before we get the program going, as an organization that certainly values our Christian principles, we would like to invite Randy up to the stage to open our program today with prayer. Randy Johnson.
Let us pray. God, your word says, unless the Lord builds a house, the builders labor in vain. Unless the Lord watches over the city, the guards stand in vain. It has been said before, and we shall say it again. We have not come this far and risen to such heights without the handiwork of God. Evidence of your work, O God, they're all around us, especially in the lives of the people, us gathered here, and those who have served in the past, and those who serve now, and those who will serve in the future. We pray that you use us and the many gifts that we represent to be a blessing to our neighbor and as co-laborers with God, for together we rise. Amen.
Great prayer. Thank you. Well, again, Randy, thank you for that wonderful and humble prayer. As we get started, what I'd like to do first is to welcome, again, everyone to today's event and acknowledge some of our local leadership and dignitaries that took up a lot of their valuable time today to come and support Pikeville Medical Center and the 3,000 plus employees that represents our fine organization. So as I call your name off, if you don't mind, if you could at least raise your hand so that we can acknowledge where you're sitting, and then at the end we will, if you could hold your applause until the end, we would like to give you a proper welcome. So we have with us today Congressman Hal Rogers, Field Representative Adam Rice, Senator Ray Jones, welcome. Governor Paul Patton, welcome, Governor. We have SOAR's Executive Director Jared Arnett, welcome. SOAR's Associate Executive Director Josh Ball. We have Big Sandy Area Development Ben Hill. Ben, welcome. We have United States Federal Judge Ed Atkins. Welcome. We have USDA Representative Elwood Howe. Great partner. Welcome. We have Secretary Scott Brinkman. Secretary, welcome. We have the Southeast Chamber's President, Jordan Gibson. Jordan. We have the representative from the Governor's Office, Aaron Thompson. We have the Prestonsburg City Mayor, Les Stapleton. Talked to Les a little while ago. Welcome. Coal Run's Mayor, Andrew Scott. Pikeville City Manager, Philip Ellswick. We have Mayor Jimmy Carter. We have Pikeville City Commissioners, Pat McNamee. Commissioner-elect Allison Powers. Welcome. Commissioner Steve Hartsock. Steve. Commissioner Kim May Downey. Commissioner Bob Shurtleff. Welcome. We have Pikeville Fire Chief Packy Bentley. Pikeville Police Chief Chris Edmonds. We have Commissioner Philip Reed. We have Pike County Sheriff Rodney Scott. Pike County Superintendent Reed Atkins. We have Judge Eddie Coleman. Judge, welcome. Is there any other elected officials that we didn't catch as you came in? I apologize, I didn't see you. I'm sorry? I didn't hear anybody in the back. Keith Hall. Keith is here also. Bear with me just a second. So again, welcome everyone. I greatly appreciate, and I apologize, it's hard to see past the lights also, so I can't see past the first row as well. Over the last 11 months, there has been a significant amount of change that has gone on with Pikeville Medical Center. And today we are here celebrating a lot of the hard work of many individuals that have made today's announcements possible. We have our new president that's been elected to the board, Ron Burchett. He's certainly not new to the organization. I'll introduce Ron and several of the board members later. New changes such as myself as CEO, our COO of the clinic, our COO of the hospital. We have our new full-time CMO, our new Chief Legal Officer, our fairly new CNO, and our new organizational chart, which again I'll announce several of our members here in a moment. We also have 6 new board members. I want to say a few things about these board members. We have 15 board members that represent our organization. All are here but one. Unfortunately, Dr. Polis could not be with us today because his wife is undergoing a medical procedure. So please keep her in your prayers. But what we have is 15 people that work extremely hard. They work together. They serve on numerous committees. They put a lot of time in. And especially since my time in this role over the last year, I've seen remarkable change in the organization and making certain that investments are made and that we're staying the course to ensure that Pikeville Medical Center is and will always be the regional healthcare provider for this area. We also have a wonderful team that backs up myself and the board with over 3,000 outstanding employees that are compassionate and caring about what they do and who they do it for. Without this team, regardless of what position that they serve, a lot of today's announcements would not be possible. We're extremely excited about the path we are on. We're extremely excited about our marketing strategy and our battle cry, which you just heard, together. Together we win. Together we accomplish. And certainly together we rise. With our new marketing campaign, you saw a bit of our commercial. We redid it a little bit to make it speak to today's event. But with our new marketing campaign, we hired an outstanding marketing group, Barnes Agency, who has done a lot of wonderful things, communicating and showing our focus and our commitment to the region. But we didn't just put a commercial together. We listened. We did this through surveys. We did this by going out into various communities throughout our service area and hosting focus groups, listening to the people that depend upon our services for their healthcare needs. What we found through those conversations is that about 75% of our business comes out of 5 primary markets and those surrounding communities. Many of you here today represent those communities, and we're very grateful for that. Those communities, of course, are Pikeville, South Williamson, Whitesburg, Martin, and Prestonsburg. And again, all the surrounding communities that encompasses around those areas. 75% of our business comes out of those key markets. The other 25% are extremely vital and important to Pikeville Medical Center and what we do. Our focus, as you will hear today, is to make commitments and investments in communities to ensure that we are outreaching and providing the best clinical care and service that we possibly can to those rural communities. Our marketing campaign, again, and battle cry is together. Together we rise. Together we grow. And together we will succeed. We currently have clinics in Harold, at the Pikeville Walmart, and in Shelby Valley. What you'll learn today of our strategy to expand those services to make it more convenient to more people and, again, more rural areas. Our mission is to continue our growth while enhancing our delivery of world-class healthcare in a Christian environment. Today, you will hear of new investments, new services, about new physicians, and more important, about new job opportunities. Again, together we grow. We recently also announced that we were successful in our certificate of need. We succeeded by generating an additional 40 beds into our hospital, which brings our total to 320 acute care beds and 20 rehab beds. Secretary, this was a long 10-month process of which we appreciate your support, but we were excited to be able to announce recently that we were successful, bringing more opportunity and more care to those that we serve. Because of this growth, and because of what you'll hear today, PBS, Public Broadcasting Service, their News Hour program hosted out of Washington, D.C., recently contacted the hospital because they heard of the good work the Pikeville Medical Center was doing, but they looked across the country at what healthcare means to America, not just from the service that we provide, but also about the economic opportunity and prosperity that brings to many communities such as Pikeville. Pikeville Medical Center represents over 17% of the total county's wages and salaries, and we make up over 60%, Philip, of the city's occupational tax. Over 3,000 jobs of families putting food on their table, providing a wonderful service to the region, and PBS heard that message loud and clear. So much, in fact, that they are slated the 1st of December to air a 1-hour program that would be broadcasted nationally about Pikeville Medical Center and the value of what we bring to the region. I could not be more proud of the 3,000 people strong that look after over 450,000 people within our service area. Together we grow. PMC continues to be accomplished as well. Recently, Pikeville Medical Center has been the recipient of several awards, which is really the essence of who we are and what we do. The quality of care that you receive and that I receive and that my kids receive is second to none. Not just in eastern Kentucky, but throughout the whole region. We've got some of the best equipment, some of the best doctors, and certainly the best staff that you will find anywhere in healthcare. I'm extremely proud to serve in this capacity and to represent the 3,000 faces that make up Pikeville Medical Center. Those accomplishments can be seen through recent awards. Growing up in a community, I understood what it meant to have to travel outside of Pikeville for services, as many of you did as well. As a regional tertiary care center, that is no more. We can stay home to receive the quality of care that we should expect and people of this region certainly deserve. That is acknowledged through numerous awards. I'd like to go through some of these recent awards that Pikeville Medical Center and the 3,000 strong together we accomplished. The first award recently is a huge honor, which is the Joint Commission Gold Seal of Approval. Next is the American Heart Association Advanced Certification for Primary Stroke Center. We also received the U.S. News Gold Plus Achievement for Stroke. And then recently, the 2019 CareCheck America's Top Quality Hospital for Medical Excellence. We received the Kentucky #1 hospital in joint replacement, the #1 hospital in orthopedic surgery, and the 2019 CareCheck #1 Kentucky hospital in overall medical care. CareCheck also recognized Pikeville Medical Center as a top 10 in the region and the nation for medical excellence in joint replacement, major orthopedic surgery. We were the top 10% in the state, region, and nation in Patient Safety Award for overall medical care, chronic obstruction pulmonary disease, heart failure treatment, neurological care, and women's health. We were also in the top 10% in the region and state for heart attack treatment. We recently also received the CODA Platinum Award for the Workplace Partnership for Life campaign. We received the Stroke Center American Heart Institute Association Get With the Guideline Gold Award. The Bariatric Department received the Quality Improvement Program through America's College of Surgeons. The Bariatric Department for the Metabolic Bariatric Surgery Accreditation. And then our recertification as a Level 2 Trauma Center, the only Level 2 Trauma Center in the state of Kentucky. There's only 2 Level 1s. We received the Cardiac Diagnostic Echo Department accreditation in adult echo and stress echo, and then also the accreditation for family practice and orthopedic recognition. Again, these are huge accomplishments by the many, serving the masses. Together we achieve. Now let's get to the main event. At this time, I would like to introduce several of our board members who have the unveiling of several different projects as of to why we're actually here today. First up is our president of Pikeville Medical Center, Ron Burchett. Ron has served in this capacity as a board member for many, many years, lending his time, his quality of excellence, his prestige, and certainly great legal mind to the hospital. So we're honored to have Ron in this capacity. So we have Ron Burchett, we have longstanding board member John Labreche, and then we have our Chief Regulatory Officer and Executive VP, Cheryl Hickman, for the first announcement.
As everyone knows, heart disease is the #1 killer of men and women in the United States. Because of this, Pikeville Medical Center has been investing in cardiac care since 1975. In order to appreciate where we are now as compared to where we were then, You must understand our history of investing in cardiac care. In 1975, I was one of the original nurses chosen to be trained to work the new 4-bed cardiac care unit. We went through extensive training of learning EKG interpretations, drug administration, and overall care of the cardiac patient. We were proud to be a part of this new unit. We were also trained on transporting patients that needed a higher level of care. What most do not realize is that we were in the back of an ambulance for 2.5 hours with sirens and lights going, sometimes in the dead of night, down the mountain parkway with a set of orders in our hands to help the patient's pain and nausea, or if the patient's heart went too fast, too slow, we had orders to help us get the heart rate back into a regular rate or rhythm, or if it was truly cardiac arrest, we were in the process of how to do the code. Also, the families were traveling behind us. When we got to Lexington, most of these families could not afford to stay in hotels. They slept in the lobbies of the hospitals that we transferred the patients to. Now let's fast forward to 1998. We're still transferring patients to Lexington, to Louisville, etc. Our CON is approved for our open heart program. Extensive training for the staff begins. Cardiothoracic surgeons are in place. December 1st, 1999, we perform our first open heart at Pikeville Medical Center. 5 days later, the patient goes home. The result, a new beginning for extensive heart care in our region. The staff now believes that they can do it. January 2000, our first heart cath with stent placement is performed by our cardiologist in the cath lab. Today, we have 3 state-of-the-art cath labs with the latest equipment to give our patients the best health care possible in the Commonwealth. Today, we are unveiling further monumental capital investments that will forever change cardiac care, not just for us, but for our children, for our grandchildren, and for future generations. This project is located in the Miners Building on the 1st floor. The area currently known as the Heart Institute will cover more than 26,000 square feet of space on the 1st floor. The new space will include registration, a new cardiac rehab department, 29 exam rooms, 2 waiting rooms, 1 new EP cath lab, 1 new cath lab, 1 existing EP cath lab, each with their own control room to monitor the patient always. 6 pre-post-operative bays, physician locker rooms, and multi-purpose rooms. Ron?
Thank you, Cheryl. Demolition has already begun at the Miners Building, and this 14,000 square feet area houses physician work area and several important services. The Miners Building will also see a 2-story addition adding about 9,000 square feet, and will receive a new skin and exterior, giving it a new modern look. But not only will you see a state-of-the-art facility, but the services we are providing will save countless lives right here in our community. Not only will you see a state-of-the-art facility, but the services we are providing will save countless lives right here in our community. Let me tell you about some ways we'll do that. Dr. Chase Reynolds, Dr. Michael Antimasaris, and Dr. Muhammad Ahmad have all been trained in the new Watchman device. Our electrophysiologists are some of the first physicians in Kentucky to implant the Micra leadless pacemaker. We are one of the first hospitals in Kentucky to receive a new technology for mapping electrical systems in the heart. Our new hybrid equipment in the cath lab now allows us the capability to perform transcatheter aortic valve replacement, which is an advanced procedure that interventional cardiologist, Dr. Ahmad, and cardiothoracic surgeons, Dr. Deal, Halpin, and Atom, are all trained to perform. One of our surgeons, Dr. Halpin, recently made news at PMC when he performed the region's first open heart maze procedure. We're very proud of that. All this means that PMC patients can now see faster recovery, smaller incisions, and overall less pain at the hands of our skilled physicians. John's going to tell us more about that.
Thanks, Ron. These amazing procedures that have never been done in this region before are procedures you would have had to travel hours to receive. When it comes to heart care, time is muscle and minutes matter. Cheryl didn't tell you that some of those rushed ambulance runs down the Mountain Parkway were not successful. Some of those patients didn't make it. Now we are a more capable hospital and can give you that golden hour, those precious minutes that will save your life. We hope you never need us, but if you do, we're here. We added several exceptional physicians to the Heart and Vascular Institute during 2018. General cardiologist, Dr. Anatawi, Dr. Ghosh, Dr. Imam, Dr. Pali, cardiac thoracic surgeon, Dr. Deal, and interventional cardiologist, Dr. Panisetti. Expansion of the Heart and Vascular Institute is a USDA bonded project thanks to the support and endorsement of Congressman Hal Rogers. The price tag is estimated at $32 million. The estimated completion date is 2020, August.
It has been said that when you are standing still, you are falling behind. As you can see, the Heart Institute is not falling behind. We are moving ahead to give you the best care possible, but we have to work together. It is all of us in it together in order for our region to succeed, not just in healthcare, economically. We have to believe that we can do it. Once you believe that, anything is possible. And this is the most important takeaway from the program, is that together we are strong, together we're going to grow, and together we will succeed. Donovan?
Thank you. Again, my apologies due to the lights and our list. I'd like to also welcome a few other guests that I missed. One of our greatest partners with Community Trust Bank, Rick Newsom, is also here. And our Commonwealth Attorney-elect, Bill Sloan, who I couldn't see because of the lights a moment ago. And then also Mayor Jimmy Carter, again, welcome. Our next announcement is on an exciting quest that we took several months back on a new expansion, but with that expansion came additional opportunities. So with that said, I'd like to introduce Kansas Justice, who is our Chief Operating Officer, and then also our board member, Dr. Dennis Halbert. And before Kansas, you speak, Dennis has been a long-serving board member with Pikeville Medical Center and has served, and obviously with a different capacity with the hospital with radiology. He's been a vital part of the hospital's growth over the years, and unfortunately, or fortunately for him, Dennis has recently announced his retirement and will be leaving Pikeville Medical Center at the end of this month. So we wish him well, and we thank you, Dennis, for your hard work, your commitment, and your loyalty for what you did with Pikeville Medical Center. Thank you.
Continue with their commitment to provide world-class quality health care. The laboratory is undergoing a $7 million renovation and expansion project. The growth will cover nearly 10,000 square feet. Phase 1 of the project, our core lab, was recently completed and is now operational. The core lab is highlighted by a new state-of-the-art automation line and 10 new analyzers. The automation line is the only one of its kind in the state of Kentucky and one of very few in the nation. We have been able to reduce our turnaround time by up to 50%. We also have been able to bring in-house about 200 tests that were previously sent to our reference laboratory. What this means for our patients is quicker turnaround time and better diagnosis. We are now performing 98% of our test volume in-house. The national average for hospital laboratories is around 85%. And this is just the beginning. Today, we are unveiling Phase 2 and Phase 3 of the laboratory expansion project. Phase 2 will be highlighted by new grossing station, new state-of-the-art special slide stainer, and new immunostainer. We will be performing testing at PMC that is only performed in specialty laboratories and research centers. This will tremendously reduce the turnaround time for our pathology reports that our physicians and patients have to wait, reducing the anxiety for those patients, and also enabling our oncologists to treat and diagnose the type of cancer quicker and more accurately. Phase 3 of the project will concentrate on our microbiology area and also have a counseling and area for our patients to come to. The microbiology advancements will dramatically reduce the turnaround time that it takes to identify bacteria and viruses, again, helping and aid quicker diagnosis and treatment to our patients. The estimated cost of the laboratory expansion is $7 million. Back to you, Don.
Kansas Dennis, thank you very much. One of the areas of opportunity and growth is regarding our clinics. When you look at 2013 forward, on the screen you'll see the growth that we've encountered with yearly new patient visitors. From 2017 through 2018, we grew by over 4,000 new patients. The services that we're providing and with the new physicians, the new service lines, and our facilities have certainly required a new demand for us to go into rural markets to ensure that we're providing that care for the convenience of our patients and our communities. So next up, with this in mind, I would like to introduce to you Melissa Thacker, who is our Chief Operating Officer, and Dr. Mary Simpson, who is our board member.
Good morning. I'm proud to announce that for the first time ever, Pikeville Medical Center now has a family practice clinic in the city of Martin, Kentucky. The residents of Martin lost a very busy family care practitioner when Dr. John Triplett came to Pikeville Medical Center as a hospitalist. Realizing the void in the community, Pikeville Medical Center committed to growing our family practice services, providing the Martin community with the convenience of a clinic close to home. The clinic will provide these patients with an easy transition for advanced specialty care at Pikeville Medical Center when needed, and increased access to advanced testing and specialty services with the comfort of knowing that those physicians are just a phone call away. The clinic recently opened its doors and has shown consistent growth week after week. Upon opening, our healthcare services were provided by our physician assistant, Mike Williams. After consistent and substantial growth and the rising need for healthcare, we have already placed 2 additional practitioners at the Martin Clinic, Dr. Janie Watts and nurse practitioner Tanya Hatfield. For added convenience, patients can have their labs drawn at the clinic, take advantage of extended hours, and receive osteopathic manipulation therapy on Thursdays or Fridays. The newly opened practice has seen a substantial amount of patients during our short time in operation. We are seeing patients from 8 a.m. to 8:30 Monday through Wednesday, and from 8 a.m. to 4:30 on Thursday and Friday. As our patient base continues to grow, so will our clinic hours. Our clinic has nearly 2,000 square feet and 6 patient exam rooms. The total investment cost at Martin Clinic is just under $102,000. Back to you, Donovan.
Melissa, thank you. Early in my presentation, I mentioned the 5 key markets that we're in: Pikeville, Martin. Next up, I want to introduce to you Michelle Rainey, who is our Chief Nursing Officer, and our new board member, David Baird.
Hi, good morning. We understand that access to health care is challenging. The purpose of us looking at Whitesburg area is we realized that our current size and location and our parking was not convenient for our patients. For these challenges, we went out and we actively began seeking property. We feel that we chose the perfect location that would allow us to better serve our patients and families by purchasing the Whitesburg Motel. We feel we chose this hotel because we were very excited to announce the major expansion of our Whitesburg Hotel. Our clinic currently serves neurology, cardiology, vascular, and electrophysiology. We treated almost 6,000 patients last month alone. Demolition is complete and remodel is underway. We will be conveniently located between Food City and across from Mountain Comprehensive Care. You will find front door parking and space with the clinic that will allow us to grow. Initially, we will be occupying the first floor and newly remodeled exam rooms. We have plans to add additional clinic space to the second floor as we continue to add new services and providers. It is very important to our patients' health to extend our specialty services to our surrounding areas. The Whitesburg PMC Clinic is operated with 11 healthcare providers and a wonderful staff. We plan to provide more providers as the needs will arise. We will provide complete diagnostic services and attempt to make same-day appointments to prevent additional travel for our patients. PMC is committed to providing our services and bringing more convenience to our patients in and around the Whitesburg area. Our total investment for this property is $1.7 million, and our estimated opening date is February 2019. Back to you, Donovan.
So thank you. Now we've talked about Martin, Pikeville, Whitesburg. Next, I introduce to you Tony Dameron, who's our Chief Information Officer, and Mike McCoy, and talk about what's going on in Williamson.
Thank you, Donovan. Good morning. So today we're pleased to announce our plans for the South Williamson, Kentucky area. We currently offer services in South Williamson for cardiology, neurology, and electrophysiology. The physicians that travel out to South Williamson to deliver those services are Dr. Chase Reynolds, Dr. Naveed Ahmed, and Dr. Pramesh Dakal. We do have a major expansion plan for the area, as you'll see with Micah unveiling the picture here on this side, and then as well as on the screen up in the front of the room. So that's the new building plan for South Williamson. So how did we prepare for this? We purchased land on the busiest and the main roadway in the area, which is US Route 119 for all those familiar with that area. The land that we purchased is situated near the Food City and is at the foot of the hill that goes to the South Side Mall. Walmart is also within seeing distance from that location. It's located only just a few feet away from the door. So it's very visible in the South Williamson area. The traffic count in that area is approximately 14,000 per day. That makes that a very prime location, a very convenient location for all of those patients in that area. So how are we going to do this? After we finish up the prep work on the land, we're going to bring in for the first time a custom modular structure that will house a new heart and specialty clinic. That's it there. And the primary care clinic will also be there. We plan to enhance the services that I've already talked about earlier with cardiology, neurology, and electrophysiology. And as you can see, the size is going to allow some expansion for this very important market for Pikeville Medical Center. So where are we currently? So today, we're in the advanced planning stage for this clinic. And as Mike shows us here, the floor plan for the clinic, and the floor plan's on the screen in the front of the room also. So as you can see, it's going to be a large clinic for us. It's when completed, it's going to be almost 9,000 square feet, and we expect this to be completed in the May 2019 time frame. When completed, the land and the building together come in at a price tag of just over $2.2 million. So we're anxious to get this project completed. We're anxious to get this new location open for business. That new location is going to allow us adequate space for future growth. It'll give us excellent visibility, and it'll give our patients ease of access. So we're excited about that. Donovan, that's the update for South Williamson.
Great, thank you. I think I mentioned this, but if not, Mike is one of our newest board members, and he serves a very valid role in what he's doing, valuable role to the organization, so we'd like to welcome Mike. Our next announcement has to do with the work that we've done over the last several months. One of the things that we recently launched was a feasibility study in looking across the market to ensure that we have adequate doctors and services to provide the very best care that the market demands and requires. One of the shortfalls was in the area of primary care. So we elected to make a major investment to ensure that we're able to enhance and serve the need of the region. With that said, I'd like to introduce to you Dr. Aaron Crum, who is our Chief Medical Officer and our Assistant CEO, and then longtime board member Jonelle Robinson. Dr. Crum.
Thank you, Don. In March of this year, Pikeville Medical Center completed the construction of our standalone information technology building. Initially, our plan was to have that information technology services all housed in that one building. However, our plan changed because of the need. Our growing relationship with the University of Pikeville, with the Kentucky College of Medicine, the success of our family practice residency program led by Drs. Kingery and Hopkins, as well as our rapid growth in our family practice clinic, which is staffed by Drs. Gadaro, Shurtleff, and Hopkins, Tackett, all culminated in the need for more space. For patient convenience, we decided to relocate our family practice clinic to the first floor of our information technology building, so we'd have a truly on-campus family practice clinic. The parking for this will be front door. It's adjacent to the building. The plans for this clinic is to be a modern, inviting atmosphere for our patients. This will put patients directly behind our hospital, which will provide easy access to the hospital itself, which allows you to have just across the parking lot entry to laboratory pathology and advanced specialty services. The family practice clinic itself will see patients of all ages, as it does now. This clinic will accept appointments and walk-ins. You'll be able to select the physician of your choice while you're there. Also, by July, we expect to have 3 more family practice physicians added to our family practice group of providers. I think that the need for regional primary care services, as Donovan mentioned, we've done some surveys. It's expanding, it's growing, it's unmet at this time. And I think this is just an example of how Pikeville Medical Center is expanding to meet those needs. Total cost for this project is $811,000 plus. Donovan?
All right, thank you, Dr. Crum. A lot of the investments are not just in facilities and bricks and mortar. They're also in areas to ensure that we're providing the very best quality of care for our patients and convenient services. With that in mind, I'd like to introduce to you Eric Blackburn, our Chief Legal Officer, and Jodine Anderson, one of our long-time standing board members. Eric?
Thank you, Donovan. The atrium on the second floor of the hospital is undergoing extensive change. We recently relocated our home medical equipment showroom to a building beside the old Poly Lumber location here in Pikeville. This allows for expansion, wider product selection, and more convenience for our home medical patients. But that move in turn allows freed up space in our atrium, where we can create a more relaxing environment for our patients and their families during what can certainly be a stressful time in their life. It also creates retail opportunities in the atrium for an improved experience for patients, visitors, and employees, as well as bringing additional jobs to the hospital. The retail space includes our corner market, which is a gift shop and convenience store, and soon it will also include our very own coffee shop. Now, we can't yet officially announce the name just yet, but it will be a national brand, a household name that everyone will recognize. And we know that our patients, visitors, and employees will be happy with the new experience. It will be a full menu store, not just a kiosk, and feature all the specialty items that our region has desired for years. It will be located beside our corner market on the second floor, as close to the hospital's main entrance as possible. As Joe shows the floor plan, our coffee shop will feature a customized decor that features cultural elements of our region. The locations of this particular brand are no longer identical, but have unique features to the area in which they're located. The atrium will also feature patient tracking boards. We have these digital screens already in our surgical waiting areas. These screens allow families to track their loved ones throughout the surgical process. That will be expanded now to include screens in the atrium where families can track the patient while also enjoying a specialty coffee and a snack. We've already upgraded our coffee service in other areas of the hospital, such as our 11th floor cafeteria and on patient trays, where we're featuring Seattle's best coffee, again, for an enhanced experience. The coffee shop project involves the renovation of 1,300 square feet of space. The construction cost is estimated at $1 million, and our estimated completion date is March 2019. Donovan, that's the coffee shop.
Thank you. We have been able to give the green light, I guess, to announce it internally, so our employees know who the brand is, as does, I'm sure, most of the community by now. So we're extremely excited with all the bricks and mortar and the projects that we're doing throughout the hospital. Probably from an employee standpoint, this one's really got their attention, so we're really excited. Due to the sake of time and the schedule, we are airing live on WYMT, which we greatly appreciate them broadcasting. I'm going to move the agenda around just a little bit to make sure that we capture the last couple of announcements, and then I'll come back to the last or two additional announcements at the end. So those of you be prepared. I'm coming back to you a little bit, so my apologies, but I want to make sure that we get these important announcements in on the broadcast. I think we'll have enough time, but just in case. So we saved the announcement that we're going to talk about now for last, and there's a reason. So as you look about all the projects and the millions of dollars of investments, all these projects are not only creating construction opportunities and new service lines, each one of them comes with the demand of new clinical personnel, support personnel, service personnel, jobs. So we're excited about the investments and certainly looking forward to all these projects actually coming to fruition and us able to open our doors and provide the services. With that said, one project certainly stands above most outside of the heart clinic. All these are important to the area, but a new service that the board is really excited to talk about today and to announce, I'm going to turn it over to Dr. Jody, who many of you know is a long-standing, very respected pediatrician of this area. She took care of my kids. Certainly wish she was still practicing to take care of my grandkids. But Dr. Jody and my wife, board member Debbie Blackburn.
Good morning. I'm holding a very exciting news for all of you because it's dear to our heart and it is one of the best investments that we'll be making in the area children. This is the Children's Hospital of Pikeville Medical Center. Pikeville Medical Center has always been a very, played a crucial role in taking care of the children and providing the advanced medical care for quite a long time, as long as I have been here. Right now, for the clinic at pediatric department in Pikeville Medical Center, we have 4 full-time, highly qualified physicians who provide inpatient and outpatient care. Our clinic is providing inpatients for the hospital, and it is located right next to the OB clinic. As we are advancing, adding new physicians, the number of patient visits are increasing, and to be able to accommodate more space for them, we did decide to expand the services and relocate. On the top of it, we had quite a few children who have been being transferred out of our facility for further care in the recent past. So we realized there is a need for expansion of the services for inpatient care as well. So this children's hospital idea evolved into a new development. The interesting part of it is the location designated for Children's Hospital is what is today's administrative block, including human resources. the best part of it is the access for the parents. As they bring in the children, they don't have to walk all the way, all hallways across the whole hospital. Instead, they will be able to bring in straight from the main entrance, from the information desk, from near the corner shop and coffee shop, right into the main entrance of the children's hospital. And we also have the parents also don't have to travel long distances taking their children to get the further care in other hospitals like Lexington Children's Hospital or Cincinnati Children's Hospital. This will involve multiple phases. Phase 1 is relocation and expansion of the clinic space. We will have state-of-the-art clinic space for examination rooms, 17 of them, and very spacious waiting area. And the decor of the clinic would be very appealing to the children with bright colors and characters that would entertain them and keep them busy and stop worrying about the doctor's visit. We will be providing care for the wellness checkups as well as the sick children. Sick children are the most valuable time is not keeping them waiting. So the spacious waiting room would take care of them, and the number of examination rooms also will be expediting the process. And the second part of it, second phase is the expansion of the services and relocation of the inpatient. This unit will have accommodation for more number of children to be hospitalized and given state-of-the-art care. And the cost of this whole project, initial estimation is $7 million. And I'm looking forward to see this project take shape and bring best possible care for our local area children, keep them home with the family support, and avoiding extra expense and economical burden on the parents to travel all the way to other hospitals in the area. Thank you. Donovan?
As I mentioned, we have a couple of projects that we'll discuss here in a moment, but what I would add is that every project that you see around the room thus far and the new projects, they're either under design, they're in demo phase, or they're actually under construction. So these projects are moving forward. We're extremely excited. I say that because these projects, especially the Heart Institute, would not be possible without our state and federal partners. We have a couple of guests that unfortunately due to other commitments cannot be here today, but they took the time to tape a few messages for us. So at this time, I'd like to key up the first message, and it's from our partners. I introduced Elwood Howe here earlier, but Hilda Lake, who is the State Director for USDA and RD, has been a great partner over the year, investing millions and millions of dollars in bond opportunity, low-interest bonds, allowing us to make investments such as the May Tower, the parking garage, and now the Heart Institute, along with several other projects. So we appreciate our partnership and certainly their support.
Good morning to all of my friends in Eastern Kentucky. I wish I could be with you today at this momentous press conference, but please know that I am there in spirit and I am there to help you celebrate these well-earned accomplishments. As State Director for Kentucky's USDA Rural Development Office, I want to congratulate the Pikeville Medical Center for the vast expansions that they have made over the past few years and the new advancements to health care that they've provided in Eastern Kentucky. We acknowledge that Pikeville Medical Center is one of the leading medical providers in all of Kentucky. Rural Development is certainly proud to be a partner in bringing these innovative technologies and modern facilities to the heart of Appalachia. In fact, Rural Development has invested over $203 million in the Pikeville Medical Center in just the past 8 years. As a part of that dedication to rural healthcare services, we have contributed in our Community Facilities Program $114 million just to help with the Heart and Vascular Institute, the laboratory facilities, the clinical complex, and the network headquarters expansion. By providing these essential tools, Pikeville Medical Center is providing all-inclusive health care to its neighbors. Thanks to our partnership and the work of the leaders gathered here today at the Pikeville Medical Center, we see these advancements in medicine helping improve the quality of life for all the residents of Eastern Kentucky. Congratulations, Pikeville Medical Center. Job well done. We at USDA hope to continue to be your partner in the future.
As we know, they will be. Next is a message from a dear friend who I've had the opportunity of working with for a very long period of time. His footprint is seen throughout the entire region, and unfortunately, he couldn't be here today, as he'll explain why. Congressman Hal Rogers.
It's an exciting day. It's an exciting day for Pikeville Medical Center in all of Eastern Kentucky. Congratulations to the Board of Trustees and CEO Donovan Blackburn on today's remarkable announcements for growth, and specifically the expanded health care services for children in Kentucky's Appalachian region. Although I couldn't join you in person today, I wanted to let you know that I'm cheering you on from Washington, D.C. Every time I visit Pikeville, I'm amazed by the progress and growth that's visibly taking place downtown. From all the new businesses to the expansions at the medical center and the University of Pikeville. In addition to all of the construction equipment and new buildings popping up across the landscape of Pike County, it's the continual vision casting and preparation that I hear from leaders like Donovan Blackburn that pave the way for a brighter future in our region. I believe in planning your work and working your plan. And this hospital always has a plan to improve health care in our region. Despite the downturn of the coal industry, the people of Eastern Kentucky have proven once again that we can overcome, that we are resilient, and together we can reshape and reimagine the future of Eastern Kentucky. I applaud Pikeville Medical Center for leading the way and proving our best days are ahead of us.
And then, of course, we've got a great partner in Frankfort that understands the value of Pikeville Medical Center, Pikeville, and has worked diligently over the last couple of years of creating opportunity, job, and certainly supporting our mission. So I give you Governor Matt Bevin.
Hi, this is Kentucky Governor Matt Bevin. I so wish I could be with you there today as you announce this unbelievable investment in health care in Eastern Kentucky. By now you've heard the details, but bringing a heart institute, bringing diagnostic capabilities, bringing a pediatric-focused health care to the Pikeville Medical Center and the surrounding community. These things are going to be such a blessing to that community. $50 million worth of investments, hundreds of jobs that are going to be created, but more critically, the ability to reach people right there in the Eastern Kentucky community. We've already got a clinic that's opened up now in Martin, Kentucky. We have one that's opening up in May, I guess in December in Whitesburg, and next May we have one that'll be opening up in South Williamson. These things have been announced. Those are going to be transformative in those communities. There's so much good news happening right now. It's an exciting time to be in Kentucky. It's an exciting time to be in Eastern Kentucky. Congratulations to all that were involved in helping to make this possible. I want to thank Congressman Rogers and others on my team who've been working together to make sure, from Department of Local Government, Sandy Donahue, all the folks that have worked so hard to make this possible, and to all of you that are going to make sure that as we move forward, these things are the success that we know they can be. Congratulations to all, and I'm excited to see what impact this will have on our communities in Eastern Kentucky.
Though the governor cannot be here today, a good friend to Eastern Kentucky and to the state of Kentucky, and a good friend of mine, has made the trip. We'd like to welcome Secretary Scott Brinkman, who currently serves as Secretary of the Executive Cabinet in the Governor Bevin's administration. In this capacity, he oversees the various cabinets and is responsible for implementing the governor's policies and programs. We certainly appreciate the Secretary making the trip and coming today to celebrate today's announcements. Secretary.
Thank you for having me here today. The governor did have a long-standing commitment. Otherwise, he would have been here in person celebrating this really exciting news. But his last instructions to me were to certainly offer congratulations to Pikeville Medical Center for the tremendous investments that are being made and the jobs that are being created, but more importantly, to thank you. Thank you, Donovan. Thank you for the entire leadership team, the board, and others with Pikeville Medical Center for the investments that are being made, the jobs that are being created, the additional health services that are being offered, enabling the people in this community, in this region, to have so many more of their health care needs met right here in Pikeville versus having to travel long distances to have those health care needs met, which we understand creates so much more stress for the patients and their families. So thank you very much. The governor has so much respect and admiration for the people of this community and this region for their resiliency and toughness in meeting challenges. We certainly, as the congressman alluded to, we certainly understand the challenges in the coal industry the last decade or so, the decline in production, the jobs that have been lost, but to see the diversification in the economy that's occurring here in Pikeville as well as throughout all of Eastern Kentucky is so exciting. The governor is so appreciative of all the phenomenal ideas that are being formulated, the investments that are being made, the jobs that are being created, and the hope that's being provided. It truly is inspirational. The governor is also so appreciative of the way in which local leaders in this community and this region are collaborating in meeting challenges and solving problems, and the way in which the local leadership is working with state officials in Frankfort as well as federal officials in Washington. That's how good things happen. That's how challenges are met, problems are solved. And with that continued collaboration, there is no reason whatsoever that the good news that we're celebrating here today relative to Pikeville Medical Center cannot be replicated in so many different ways, in so many different formats in the years and decades to come. Again, thank you for giving me this opportunity to be here today. It truly is a privilege. Thank you.
Thank you, Secretary. Thank you, Secretary, for your comments. At this time, we're going to wrap it up for WYMT, and then we're going to come back and make our final two announcements. But we certainly appreciate the viewers today that tuned in to listen to the millions of dollars, over $54 million worth of various investments for the region that we are so proud to serve. So thank you for tuning in. With that said, our next announcement has to do with additional job creation and an investment in the community. So our intent is not to only provide clinical service, but also to make sure that our patients, after they leave the hospital, have the conveniences that they deserve and able to talk to somebody local to address any issues regarding their stay with us. So with that said, I would like to introduce our Chief Financial Officer, Michelle Hagee, and again, long-standing board member, David Collins.
Thank you, Donovan. We recognize our responsibility as the economic driver in the region, and we understand that the economic future is by and large about jobs. The Kentucky Hospital Association released a publication speaking to the economic position of every hospital in Kentucky. And what we learned is that 17% of Pike County's total wages come from PMC. Based on PMC's growth as the region's largest employer with nearly 3,000 employees and even more service lines today, we expect the percentage to be even higher. With that in mind, we're happy to announce that we're bringing another department back in-house, creating even more jobs at Pikeville Medical Center. Our plan is to bring physician billing and coding back in-house, a move that will bring 45 jobs back to the hospital that since late 2014 have been outsourced outside of our region. This department is responsible for ensuring accurate charge capture, coding, billing, accounts receivable follow-up for services that our employed and contracted physicians and allied health professionals provide to our patients. We've decided to bring these functions back internally to ensure the quality and the accuracy of our patients' bills. Our goal is to be fully staffed and ready to assume these responsibilities by August the 1st, 2019. Having a local voice and a local contact means everything when it comes to patient satisfaction. We've already started hiring medical coders, and the coders will occupy the former banquet space at the top of the landmark. And this project is expected to be completed in February. We are also going to be renovating the Mark II to house the billing department. This total renovation involves about 2,000 square feet of space with an estimated cost of just under $180,000. We discussed many projects today. Some are remodels and others are additional services and or locations. The great news is we're growing at Pikeville Medical Center. We're adding services and for the convenience of our patients, and we're providing more jobs. In fact, we anticipate hiring several hundred new employees over the next year. Back to you, Donovan.
Michelle, thank you. Last up for the announcement, of course, is myself, and then Clint Martin, a board member. As you can see now clearly, Pikeville Medical Center is more than just a healthcare provider. We have become a healthcare network. We're growing our service lines and taking healthcare to those who need it most. We manage right now 1.6 million square feet in 43 separate facilities spread throughout our service area. Our model must change, as has our business plan. With the evolution, the necessity for the creation of a healthcare network headquarters is necessary. The Leonard Lawson Cancer Center continues to grow under new clinical direction of Dr. Nola and Dr. Crute. We've hired 4 new oncologists, and our patient census continues to grow. Our mission is to make our facility and service patient-friendly. Safe, easy access with ample parking is what is deserved and needed for our patient care. Other service lines located within this complex includes our sleep lab, led by Dr. R.V. Metu, and our family practice. We also have our patient transfer center and our facility management facility located within this area. Again, with PMC's growth, it became clear that we needed to change our administrative model while expanding the accessibility of these various areas. Moving our administrative and HR offices out of Pikeville Medical Center main campus into what was recently known as the Turkin building is now underway. The importance of doing that is, which was supposed to be after this announcement, was to make room for the Children's Hospital. So the square footage that is now available that takes up the administrative offices and the HR area and our laboratory areas will now be vacated in order to pave the way for a standalone Children's Hospital. The floor plan I present to you of the new administrative headquarters and clinical complex is a new U complex which will serve both the headquarters and the various clinics. Construction and demolition has started with an expansion of about a $350,000 project. By January, PMC will relocate our executive administrative offices and HR staff in our new 9,303 square foot location. Our key administrative clinical positions will have dual offices both in the new building and in the hospital. So our chief medical officer, our COOs will both have an office at both locations to ensure that we're taking care of the hospital needs. Several structures such as the old Jerry's, the Devers building, and several other structures within the area will be removed through demolition. Demolition has recently started. The needed parking and landscape and expansion will take on this area. For those of you that are concerned about El Azules, they will be relocated to the top of the Landmark Inn. We have already signed a contract and they plan on locating there by mid-January. This project will permit us to better serve our cancer center, our sleep lab, and family practice patients with easy access and better parking. It also relocates numerous employees from the main campus. By doing so, it allows additional parking for our patients and those visiting our patients. We are excited about the changes and the new, cleaner, safe, and more accessible look. Will also permit us additional expansion for the Cancer Center in the future plans. A huge part of this decision was based upon freeing up the space needed for the Children's Hospital. We are excited because together we grow. Well, the program has run over a couple of minutes, but certainly we appreciate everybody that has come out. Again, I mentioned a moment ago that when you add all the projects up together, $52 million worth of investments with several other projects still on the books. We're excited about where the path is taking us, where we're heading, and what we're able to produce for those that we serve within this area. So thank you for coming. If I know some of you may have to leave. If you have to do so, that's fine. But if not, we have a microphone mic'd up on the right-hand corner. If anybody from the press or anybody would like to ask any questions, we'd be happy to stay around and answer those. And also, to the press that's here that didn't all make it up front, at the table we also have press packets prepared. I'll be around until about noon to talk to anyone from the press that needs to talk to me. But again, we appreciate you coming out and participating in this joyous occasion and this monumental time of millions of dollars in advancements and new job creation. Anybody have any questions? I can't see, so you'll have to. I think we answered most of them. Good, we've done our job. Well, again, thank you for coming out. We're excited. We appreciate you, and we look forward to tomorrow. Thank you.